Hi guys, I'm Debbie Boudreau, not Pam Foster, but I wanted to welcome you to our collaboration forum. It's a little different this year or this month. We're now in our different space. We're using Zoom, so we're all getting used to the technology, but I wanted to tell you a few things before we get started. So for one, I have a handy measuring device on my phone, so I know that I'm socially distancing from my friends. And then two, because I'm in here by myself, I'm gonna be able to go without my mask. So once I'm in here, I can have it without a mask. But what we're gonna do, y'all, is that we're gonna transition through our friends. So we'll start out with Pam Foster, who always brings us back to center and provides some reassuring words for us during this most uncertain time. But once Pam and I transition, I will leave and she will come in, and then we'll have a few other friends join us. So for now, put my mask back on and I will welcome Pam to provide an invocation for us.
Thank you all. I wish I could see you in person. I miss you. Today I'm going to bring a word from Socrates. He prayed to all the gods he knew with these words: "Grant that I may become beautiful from within, and that whatever outward things I have may be in harmony with the spirit inside me. May I understand that it is only the wise who are rich, and may I have only as much money as a temperate person needs. Is there anything else that we can ask for? For me, that prayer is enough," he said. I wish you well. Amen.
Okay, I'm back. Thank you, Pam, for always bringing us back to center. So you guys, thank you for joining us today. It's been 125 days since we started our command center. I know that's a long, long time. I kind of thought we'd be over by Easter, not so much, maybe in a while. What we wanted to talk to you today is about all things that are going on in our world here at Cook Children's. Things look a little bit different. We're now coming to you virtually. We're getting much better acquainted with technology, even me. Good and bad, Skype, Zoom, we're all getting used to it. So what we wanted to do is to just give you, again, a high-level overview of how things are going. So we're going to start off with a few things. I'm going to give you the agenda rundown. So we got Stan Davis, who's going to give you a state of the Cook Children's and all things that are happening in our organization. Then Dr. Susie Whitworth is going to come to you and from Zoom in her own office, and she's going to talk to you about all things COVID, from the CDC, from the WHO, from her amazing group of physicians that she collaborates with every day. Then we're going to have Beth Schmidt, our own Beth Schmidt from HR, that's going to talk to us about redeployment, about staffing, about occupational health, about our COVID hotline, about our tracers. That's got lots of information. And then we have Dr. Nelson that's going to talk to us about CCPN and all things that are happening out in our community. One of the other things, you guys, is that you had an opportunity to ask us some questions. So we've got those. And then also what we're going to do is that you can actually, during this Zoom, you can put a question in our chat box. So if we don't get back to you today, we will get back to you very, very soon. One of the things you need to know is that there's a lot of information that's going to happen today. So you don't have to take a note. You have the luxury of dialing back in and listening to us anytime that you want. You can always send us a message. I'll give you a plug for the command center. We're open 24/7, although we may not be physically on property, but we will actually answer your calls. So for today, write us a question in the chat box, and we'll get back to you. So without further ado, I'm going to let you talk to Stan Davis.
Hello, Cook Children's family. It's a great opportunity to come to you today to talk to you about what's going on around Cook Children's. Many of the things that we'll talk about are things that you may know but may not know in the level of detail. Or it may be things that you're hearing for the first time. It won't be inclusive of everything because you all do so much for our organization and so many amazing things, but this is kind of a snapshot of what's going on with our organization. But before we go into that, I'd like to take you back prior to the 125 days that Debbie just talked about, pre-COVID. Does anybody remember life as we knew it before COVID? We were planning on how we were going to get our kids out of school, where we were planning to go for our vacations, how we were getting our skills and trainings, what meetings we were going to, what parties. All of that's changed. So we have a new norm. On March 15th, when we activated our Incident Command Center, we did it as a system. So we brought entities from around the organization, home health, the health plan, our physician network, our medical center, and all of the supporting functions to look at how do we understand our new norm and how do we plan to prepare to take care of ourselves. Our first level of thought was, let's make sure that our staff are safe and our patients are safe so that we can possibly properly treat them. So we looked at it from a standpoint of what types of things would we have to evolve to. We changed things such as our PPE requirements, and those have always evolved from CDC guidance and the guidance of our infection control and infectious disease practitioners. We looked at how should we treat our patients, in what manner, based on new medications, based on new protocols. We looked at things that were coming down from us, from the state, for instance, visitation. We had to tremendously change our visitation protocols, not to our family-centered care culture, but to make sure that we were maintaining our PPE and maintaining a safe environment. We also received guidance from our CEO, Rick Merrill, pledging the support of the organization and the community for whatever it took to make sure that we were prepared and safe. One of those things was making sure that our pay was guaranteed so that we didn't have to worry about that and we can focus on each other and focus on our patients. We also began a tactic of moving people home. Those folks that didn't need to be here from the standpoint of essential patient care, how could we aggressively get them to a home environment? I'm pleased to say that we did that in a very, very expeditious manner. We also looked at, from those folks who were not actively engaged, how do we redeploy them so that if a need popped up, like a drive-through testing or screening, how can we utilize your skills and your talents to meet the needs of the organization to make sure that we were safe? We also set up COVID units. You all know them as 2 North and 3P. And we equipped the units to make sure that we had the best airflow and ventilation and to make sure we had the right equipment and the right training and education and support for our staff. We also set up drive-through testing locations. Originally, it was for all patients that were going in for preoperative procedures, but we've evolved that into referrals from our PCPs. And now basically all kids who are admitted are being tested for COVID, as well as we are now testing our employees. So we continue to evolve in regards to our understanding of what does it need to look like to be prepared for this unexpected event. And as you all know, we canceled a lot of activities. We canceled meetings like ETM, Experience Submission. We've canceled our service award banquets. We've canceled the Zoom activity that we have for us and our employees, and many other numerous functions for education and training. We've restricted travel. Those are things that we're doing because as we evolve and as we understand this, this is necessary to protect us and to protect our community, and we continue to understand that. We've, as we're doing now, gone to new technology. We're using Zoom for our collaboration forum, first time ever, and we've become accustomed to Zoom and Skype and other technologies to socialize our messages and to interact with each and every one of you. We're getting better at that, and we champion that effort to make sure that we stay connected as an organization to get our message out and to connect our culture, and no matter what the environment is. We've also championed telemedicine or virtual health, a new wave of taking care of our patients in the environment that allows for them to stay safe and for us to stay safe, but that care to occur. And our physicians and our staff and our caregivers are doing an amazing job with that. So, you know, those are the things that we continue to evolve on, and those things will always change. As new guidance comes out, as our epidemiologists tell us new procedures will continue to evolve. So flexibility and understanding that this is not a static response is very important. Our incident command team daily takes the feedback from our caregivers and our support staff and our leadership, and we try to evolve that into protocols to empower you as leaders to best manage your units. As Debbie said earlier, you all do critical thinking and critical applications of techniques each and every day. It's our job as an organization to interpret the unknown, turn it into the known, and to give you the processes, the resources, and the support so that you could be more effective than you ever thought that you could be with this particular pandemic occurring. So when this occurred on March 15th, we went into somewhat of a survival mode to make sure that we were learning and evolving. We've done an amazing job of that through you all and our incident command structure. As we start normalizing, we're going into a thriving mode. What does that look like? It looks like you being empowered to understand what's coming at you. You being empowered to know where your resources are. And you're going to hear a lot about that today from our experts. And you utilizing those resources to make that critical decision to take care of yourselves, your employees, and the patients that you're chartered with taking care of. We want to always focus on our culture. Our culture at Cook Children's is a competitive advantage. It allows us to be who we are each and every day and operate at our very best. We're challenging you as leaders to remember that culture, remember that promise, and remember that connectivity as we navigate these uncharted waters. I was in the Air Force in the military, and we used a term in the military when we developed strategies and we presented ourselves to manage any engagement that we might have, to fight the enemy, if you will. It was called a force multiplier, a force multiplier. And what that basically means is utilizing all of your resources, utilizing all of your skills and any augmented efforts to make sure you're better than what's coming at you. We at Cook Children's have that opportunity to utilize our force multipliers. An example of that is to trust our training. When we put protocols in place for wearing PPE, we have to understand what those protocols are, understand the appropriate use of PPE, and to trust if we're doing that appropriately, we are going to be safe in any engagement. We also have to take care of each other. That's one of the things that we have to remember, no matter the crisis or whatever the situation is. Take care of your fellow coworker, take care of yourself. The key thing is to slow down and see what's going on in your environment and to address it appropriately. And we have all types of resources to make sure that we are allowing you and equipping you with doing that. So one of the things I want to highlight on our force multiplication effort is our people. And I'm going to highlight a few people today that exemplify that, but they represent the whole organization. One of those individuals is Dr. Mark Mosaic. Dr. Mark Mosaic is one of our infection control practitioners, and he does an amazing job each and every day in that effort. But recently, he has also taken on the added responsibilities of helping us to identify employee exposure protocols and to manage the operational aspects of that. An amazing job. In addition to that, he took it upon himself to develop guidelines for return to school. He's interacted with over 900 school nurses from around the area, as well as his guidelines have been adapted by the American Association of Pediatrics for the correct protocols for returning to school. Very instrumental. Dr. Mosaic is one of our force multipliers. Another one is Dr. Susie Whitworth, who you'll hear from in a second. She's also an infectious disease practitioner, but in addition to those things, she has taken upon herself to help guide the organization in understanding this novel coronavirus pandemic that we're in and looking at that interpretation of CDC guidance, WHO guidance, and all of the other guidance that we're receiving from state and local officials and translating that into how do we implement that at Cook Children's. Susie is always available around the clock for our calls and our efforts, and she guides us day to day on how do we maintain our safety posture. My last example, and there are many others, of our force multiplication effort through our staff is our drive-through testing team. This is an effort that we had never done before, and it's uncharted in a lot of ways because there was not a pediatric model for it. But folks like Amanda Martin, Martin Aguada, Nick Markham, Jack Soselby, Mark Morgan Pitts, and many others, our surgical team, many others, have allowed for us to not only adopt those efforts, but to exemplify them here on campus and out in Alliance. And I also would like to recognize Dr. Starnes' endeavor from our CCP and effort for doing it out at our Northeast and Alliance facilities. So those are things that we have to leverage in managing the unknown and turning it into the known to ensure that we're taking care of each other and we're maintaining that safety that Cook Children's is known for. The Collaboration Forum is an opportunity for us to talk to you, but also get your feedback. And Debbie mentioned the opportunity for you to post your questions later on so that we can learn from that. Some of the things that we're looking at in the future, we're looking at how do we exemplify our facilities. We're planning conceptually right now a pandemic ICU. Right now, our 2 North capabilities don't allow for the families to be self-sufficient because they don't have toilets and a lot of the other amenities that our traditional patient rooms are. But through the support of the organization and the community, we're looking at a true unit that will take care of that. Because we see At some point, we'll normalize related to COVID, but there will be other situations out there where we'll have to isolate and maintain that posture that allows for us to be safe. We're also looking at how do we support our adult providers. As you know, with this pandemic, the adult patient population is more impacted than the pediatric population. We're not isolated over here and saying we're fine. We're looking at what support would we be able to offer those adult providers, and that continues to evolve. And again, the support from the community and our leadership continues to evolve to the needs of our staff and our organization. So thank you for the opportunity to present to you today. It's my pleasure at this time to introduce you to Dr. Susie Whitworth, one of our false multipliers that allow for us to be safer and more connected in our environment. Thank you, Susie. Turning it over to you.
Thank you, Stan. Can you hear me?
Yes.
Good. Laura's going to put up some slides, and I was asked to talk about kind of just a high overview of the COVID pandemic, and was going to look at data from the United States and then from Texas and Tarrant County. Next slide. Thank you. This is a chart that you all have seen 100 times. This is the COVID pandemic in the United States. Next slide. The United States so far is approaching, up in the top left-hand corner, 4 million cases. And at the rate we're going, we'll top 4 million within the next few days. Next slide. This bottom part, which the yellow bar graph, shows the number of new cases occurring every day in the United States. And you can see that there was a big uptick in March. And then in the end of May, things seemed to get a little better for a while before they really started climbing in June and July. Next slide. There have been 141, this is already out of date because this is from last night. There have been over 140,000 deaths in the United States from the COVID pandemic. And to put that in perspective, remember that in a typical flu season, there are between 20 and 60,000 deaths in the United States. So in 4 months, we have tripled a typical flu season in the number of deaths in the country. Next slide. Here is the graph of cases in Texas, and you can see that Texas sort of lumbered right along there with really great low numbers all the way through the end of May, and then probably after Memorial Day, things really began to get out of hand, and the numbers have climbed all the way through June and July. Next slide. This is hospital data for the state of Texas, and in the lower left-hand corner there it says 10,848 patients are currently in a Texas hospital with proven COVID disease. That number was around 2,000 to 3,000 for weeks and weeks and weeks up until the middle of June, when it just began to rapidly climb from 2,000 to almost 11,000 now. And it's been in the 10,000 range for about the last week and a half. Next slide. When you look at our area in particular, under the big blue area, the Dallas-Fort Worth trauma region, according to the Department of State Health Services, in the black box at the top left-hand corner, you can see that there are 1,907 COVID-confirmed patients in hospitals in this North Texas region under the blue arrow. And that was in the 400 to 500 range all the way through May and the first part of June, and it has been climbing. You can see at the bottom of this slide the Houston area, and they are close to 3,000 patients in the hospital with COVID disease in that area. Next slide. So when you go from United States to Texas down to Tarrant County, this is the data for Tarrant County from last night. And next slide, it'll show you the bar graph on the left. The tallest point, 4,300, was the week ending Monday 9 days ago. Last week, ending on this Monday 2 days ago, was down to 3,200, which I'm hopeful means that we've had a decrease in cases. I'm afraid what it means is all the test results from last week have not been put in yet. So we don't know if last week is better or not, but we can hope. Next slide. Then when you look at hospitalizations in Tarrant County, the top right-hand corner shows that in Tarrant County alone, there are 683 COVID-confirmed patients in hospital beds in our county. The big blue arrow in the middle bar graph shows, this is just a visual graphic of how things were kind of okay at the end of May, and then towards the end of June, things have just continued to spike up for Tarrant County. Next slide. So I wanted to give you just some good news at the end of this. In the news this morning, there are some reports that the hospitalization curves in Houston may be flattening instead of getting worse, which is an improvement. I reviewed an interview by Anthony Fauci yesterday. He remains very optimistic about a vaccine, which I'm hoping can put an end to all of this in the next 6 to 12 months. You are in a system with me where we have adequate supplies of PPE, we have adequate hospital beds, and we have had a significant improvement in our testing capacity over time. And all of which we're very grateful for and happy about. But I want you to know from the infectious diseases team, our goal from the beginning of this is that if we are going to help manage a pandemic, we do it well. We want things in our group to go well for you. And that's why we are constantly looking at CDC data, constantly looking at World Health Organization recommendations, new data about treatments, all of those things we are working on really all day, every day to keep up to date. We want the pandemic to go well for you. And so if you have any questions for us, feel free to call or text. We're available. And that's all I have. Now I'm going to turn it over to Beth.
Thank you, Susie. I appreciate that. I don't have to tell you all how challenging this pandemic has been for all of us. The rising numbers as a result of community spread that you heard Dr. Whitworth talk about are impacting all of us. This is real and it's hard. Almost 10% of our workforce has been on quarantine at one time or another during this pandemic. That's around 800 people who have not been available to come to work for some period of time. In addition, 109 of our employees have tested positive for COVID-19. The vast majority of those exposures were from community exposures. Just 5 were from employee-to-employee exposures. We're now seeing our employees are wearing their PPE properly when caring for patients. That's definitely a positive that I want to call out. But we need to ensure our employees are wearing their PPE when around each other. We have had 135 employees on quarantine due to potential exposure to another positive employee. One positive employee can send an entire department home on quarantine. So how can you protect ourselves, or yourself and one another? What messages can we help convey to your team and your peers? First of all, be a role model. Wear your mask properly at all times. If you see someone not wearing your mask, tell them politely that they need to put it on and wear it properly. This isn't an option and it isn't voluntary. In addition, social distance. That means staying 6 feet apart, using Debbie's measure or whatever it is she has, and wash your hands. You can also help by ensuring that your teams don't gather in break rooms and over lunch. Really discourage any sort of socializing in person. Use Zoom, FaceTime, etc. Avoid unnecessary travel, stop going to parties, and practice all of our safety guidelines. I also ask that you and your teams self-monitor and check your temperature every morning. When you get up, review your COVID-19 symptoms. Do I have a cough? Do I have a fever? Can I smell that? Can I taste that? Before every shift, how am I feeling? We don't ever want anyone coming to work feeling sick. All this sounds simple, right? But listen, I'm the first to say I'm aware of COVID fatigue and mask fatigue and every other fatigue that we're going through right now. It is super stressful to be on high alert for 125 days and counting, just like we've been We all need to acknowledge that and be mindful of it. It is really easy to get lax and less stringent with our safety guidelines. But if we're going to be ready for the upcoming flu season with a healthy workforce, we need to be diligent now more than ever. We know if we work together until there's a vaccine, our numbers will go down. I also have another ask. If you have employees who've been exposed or those who are not feeling well and suspect they've been exposed, please coordinate everything with occupational health. Do not make quarantine and monitoring decisions independently of OC Health. Everything needs to go through that central point. If we are doing our best to be there for you. We're attempting to bring in more staff to respond to the hundreds of phone calls and emails that occupational health is receiving daily. We now have someone there 7 days a week to try and answer those calls, and we're hoping to increase those hours so that we can be even more responsive to your needs. Please remind your staff that everything goes through OC Health. All you or they need to do is call or send an email, and someone will get back in touch with you as soon as possible. Remember, we do have a new COVID-19 OC Health email. It's COVID-19OHS@cookchildrens.org. I'd also ask that you please be patient. This team has been working around the clock to provide a high-level service to us all. So to summarize, model the safe behaviors that we want to see from our teams. Remind people about our safety guidelines and break up gatherings, and involve occupational health in every quarantine or possible exposure scenario. So now a few other things beyond occupational health that I want to touch on. Now's the time to stay close to your people, checking on your employees who feel fatigued and those who are at home. Remember, we have resources. Our employee assistance program and our chaplains are here to support all of us. Don't forget your commitment to the team experience. Those employees who've been at home over the last 4 months may feel disconnected. You can help them feel a part of the team and more engaged by regular checkups. Do Zoom meetings. Make everybody do their hair and put their makeup on so they can be part of the team. It makes a difference when you can see someone's face and not just hear their voice. I know it's tough, but every once in a while, you can get up a little bit early and get ready. It's okay to acknowledge that this is a stressful time for everybody. Let your employees talk and tell you how they're feeling. Understand that family dynamics have changed. Tarrant County students and very likely others will be online for the first 6 weeks of the school year. This is definitely one of the things that keeps me up every night and something I know that our parents are struggling with. So please be sensitive to that. I will be very honest. We don't have all the answers, but we're working to find solutions just like businesses across America. But if you and your teams have creative ideas and you want to share ideas around childcare or anything else that we can do differently or better, please let us know. In addition to checking on your employees, check on your bosses and your peers. Our bosses are human too. As I wrap up, please be sure that you have had conversations with your people about where they're going to be working come September the 1st. Back to their pre-COVID role, permanently working from home, some combination of those. All those visits need to happen by August the 1st. In closing, I'd ask that you be kind to each other, and even more so, let's be kind to ourselves. Some days you're going to be anxious, worried, or more stressed than other days. That's okay. Self-care is a must during this time. Let's lean on each other, support each other, and we'll get through this together. That's what Cook Children's does. Thank you. I'd like to have Dr. Nelson come on next.
Beth, I didn't know we were supposed to wear makeup today. I'm here to tell you about good news so that you can feel really good about the organization and its strength. One of the ways that we can measure our organization when other organizations are having layoffs and closing down services and things is looking at what are our patients doing. If you look at the primary care patient load, they are at 95% of what they were last year. So we're doing very well there. Specialties are at 87%, and the neighborhood clinics are at 83%. So you can see our patients are coming back, they trust us, and we're able to provide the services. That means the operating rooms are gonna run, that means that the hospital's gonna run, and that means that we're going to be able to generate the funds and everything to pay everyone and keep everyone employed. Now, one of the fascinating stories that has occurred because of this pandemic was the telehealth story. Before we started the pandemic and had to make all these changes, we had 328 visits in the month of February by telehealth. Well, March, halfway through, when we started telehealth in a big way, we were able to accomplish 5,272 visits. In April, 17,000 visits. In May, it was 13,000 visits. And now that the clinics are all open and patients are coming back to us, we're humming along at about 9,000 visits per month. That's about 10% of our visits are taking place by telehealth. So it's really a remarkable story and a testimony to the flexibility that everyone is demonstrating and the rapid learning curve that has occurred. Since the clinics and ORs were closed, of course, there was this backlog that was building. Well, it's gone. We have caught up. We have very short waiting lines. In fact, our waiting lines now are shorter than they were before the pandemic. All but 9 of our specialties can see another patient, a new patient, within 2 weeks. 5 more can see within a month, and the others are very short after a month's period of time. So you can see that everyone is geared up and is really taking care of the patients so that we don't have this big backlog of patients waiting to be seen. As you can imagine, Stan and these other guys went out and built something that we had to kind of put into operation. First of all, at Walsh Ranch, we had to recruit some physicians. You think about trying to recruit physicians during a pandemic, it's a little crazy because just like I'm talking to you by this media, I'm talking to a guy in the Middle East, seeing if he wants a job. But we've been able to fill up the Walsh Ranch with 4 new physicians. We have recruited over 20 physicians for the Prosper area. And in addition, we have recruited 20 physicians to replace the ones who have retired or left our area for the main campus and our primary care practices. So despite these barriers and hurdles, we've been able to continue the things that we have to do in order to keep the system healthy and taking care of all the patients that are coming to us. Stan talked about the testing, and Susie talked about the testing. We created these drive-through things that we've never done before so far. Well, 2 days ago, we'd seen 3,300 patients through the drive-through, and 346 were positive. That's about 10% positivity. In addition, the committees and the things that we have to get done are continuing. For example, the Physician Wellness Committee has continued to meet and are carrying on their projects. So CCPN is doing very well, and we're happy to be part of this organization that's taking care of us so well. I think Debbie is back.
I'm back. Wow, that's a lot of information. Good news is there's not a test, and you guys can roll back and watch it at your leisure. One of the things we want to make sure you do is that you share this information with your staff. Again, it's a lot of information. You guys, we have had to make a lot of tough decisions, and I know some unpopular decisions over the last 4 months. One, the visitation that Stan talked about, that came down from the state, that we are making our gentlemen shave their faces. We didn't make the ladies put mirror makeup, but that was talked about. But we, most unpopular was we said no lunch meals. All of these decisions, you guys, were based on information that we have received from Dr. Whitworth, Dr. Massey, the CDC, the WHO, all of our really smart people out there that are trying to keep you, our patients, and our families, and our friends and loved ones safe. So I know we've changed a lot, and it seems like we change every day. We really haven't. But when we do change, we're changing for you. You guys are an amazing group of people. You've made amazing decisions, and even before COVID, I know that seems like such a long time ago, but you were awesome before COVID, and you're awesome now. We're stronger today than we were yesterday, and we'll be even better tomorrow, you guys. There's lots of information out there, and we want to empower you to go and get that information. So if you go and look at the COVID website, our amazing communication team, Laura Van Hoosier and Winnie and all of their peers have done an incredible job, along with Sharon Holmes and Susie and everybody from the command center that we push information out to, Casey Poland answering the phones. And so those guys have done a great job putting things on our COVID webpage. So as soon as we get new information, we populate that COVID webpage so that it can be up to date for you guys. So we would encourage your staff, just like we did this new exception list last week, right? And we pushed that out to the managers in the medical center so that you guys can make the decisions as to what those exceptions need to be. So refer to the COVID website so that you know exactly what's going to go on and it's up to date. Again, we'll continue to send you messages through the internal communication. We're working again to create other guidelines and to make sure that our staff is safe. Again, we know things change, right? Like eyewear is now we have to wear eyewear all the time. At the beginning, we didn't. So things change, and we make sure that we let you guys know when that happens. And I would like to say that we're not going to change again, but can't bet on that. No crystal ball. So all those resources, you guys, are located on the COVID webpage on CookNet. And then also, if you have questions like Beth said, go to Occupational Health. They've got a hotline, 682-303-1661. I kind of sound like a teleprompter, but that's a number. And then again, it'll be on the COVID webpage. Or you can call the command center. Don't be surprised if we answer you in the middle of the night and say, show us some grace because we've got to find our glasses so that we can write down your message. But we're here for you 100% of the time. Whether you call us, you come find us, whatever you need, we're here for you. And please know that the decisions that we make are based on what we believe are best for you at this moment, right? Because it could change tomorrow. One of the other things, you guys, I wanted to say is that make sure that if you put a question in the chat box, we'll get back to you so that we can answer that. One of the things, Mr. Merrill and Stephen Kimmel will be doing a video, and our communication team is going to push that out to you guys. And lastly, like Beth said, take care of each other, right? I think we sometimes forget, and then we get in this tunnel and we forget about how important it is to take care of ourselves and to take care of each other. Whether it's taking a walk at night, reading a book, eating carrot cake, or an ice cream. Do whatever it is that you think benefits you so that you can come back and be full force so that you can take care of our patients. You do an amazing job every single day, you guys, and I just am humbled and honored to be able to work with you. One other thing I wanted to say is that right now, I would ask you to give each other a present. I know it's kind of corny, but I didn't have a crystal ball, so I couldn't use that. So I want you to give each other a present. So I want you all to wear a mask, and I want you to, like Beth said, it's not voluntary to wear a mask. Everybody wears a mask every day, right? So I want you guys to wear your mask today, all the time, at all places, so that at Christmas, we don't have to wear these masks. They're made with Christmas fabric. Thank you to our home health department, who has done an incredible job making masks for us. But Brady, I don't want to wear this at Christmas. So you guys, wear your mask today, all right? Thank you so much. And please, please take care of yourself and take care of each other. We love you guys.